everyone, it's me again. I'm Lena and I'm from the Healthcare Landscape Group. In this video, I'll be talking about my main video, which is about A&E department. Now in this video, I'll be talking about four main parts. What is the A&E department, when to go, when to not go, and finally the components of the A&E department. So let's get started right away on my first part, which is what is the A&E department? Well, the A&E department, or the Accident and Emergency Department, is the hospital unit for serious life-threatening injuries and illness, and it is open 24/7, which means that we can go to it whenever we have any serious life-threatening diseases, and it's often called the ER in the US, or the emergency room, so that's another name for the A&E department. Okay, so the when to go and when to not go. Well, I've said that the A&E department is for only serious and life-threatening injuries. So it's reserved for people who are in those emergencies, not for emergencies that are not life-threatening. Well, when to go is when we have serious life-threatening emergencies, major injuries or illnesses. For example, loss of consciousness, choking, a stroke, severe chest pain, breathing difficulties, seizures, severe allergic reactions, heart failure or heart attack or heart stroke, severe bleeding that can't be stopped, and etc. So those are some of the common examples of when to go to the emergency room or the A&E department. So that is for when to go to the A&E department. But when is not the time to go to the A&E department? In what situations should we not go to the A&E department? Well, it's for situations that are non-life-threatening, not as serious as the life-threatening emergencies, and by using A&E for non-emergencies, it can prevent and inhibit those with more serious conditions from receiving timely and immediate care. So it will waste their golden time, as to say. So yeah, that is the consequences of going to the A&E in a non-serious situation. Some alternatives, if we have some non-life-threatening but still need some attention, we can go to pharmacies, general practitioners, call up a family doctor, a minor injury unit, or urgent treatment centers. So those are some of the facilities where we can go to in case of we having injuries that are not as severe as the life-threatening ones. So that is when to not go. Now, what is the difference between when to go and when to not go? The phone number, I mean. Well, in the UK, 999 is the service for the EMS, which is the Emergency Medical Service. That is for the life-threatening emergencies, that is 999. But for non-life-threatening emergencies, we can call 111, and yeah, that is in England. That is for when to not go and when to go. Now for the components of the A&E department. There are many components in the A&E department. There's different sections, but in a whole A&E department. So there's triage and assessment, resuscitation or resus, major injuries and treatment or majors, minor injuries, minors, diagnostic services, operating theater, coordination with other departments. So there are 7 main components that I'm going to talk about in this video. Now you might see this mind map and say, where's the process of the A&E? So I'm going to talk about my A&E in my D2 I mean, in my writing, and I'll talk about the process of the A&E department. The process of transporting to actually going to the hospital. So yeah, that is an introduction to the components, but then we need to go deeper. What is triage and assessment? So for this process, it is a process where patients are quickly assessed and prioritized based on the severity of their conditions. It is serious, it is is it mild serious or wildly serious, extremely serious. Patients are assigned a priority level, for example, red for immediate, yellow for urgent, etc. To ensure the sickest and the person who needs the most care are prioritized first. So they need immediate care and need timely and immediate care as well. So that is triage and assessment. Resuscitation or resus. Well, this is a section, a dedicated area for patients with life-threatening serious emergencies such as cardiac arrest, heart attack, and is equipped with immediate access to resuscitation equipment for us to revive, as to say. So that is resuscitation. There's the major injuries or treatment, or sometimes it's called majors. I'm going to refer it to the majors. So the majors is a section for patients with serious but not immediately life-threatening conditions. So this is one step below resuscitation. So resuscitation is first. So I'm going to write resuscitation. 1, resus. 2 is majors. So this is the most serious, this is the second most serious. And so the majors is for those who have life-threatening but not immediately. So it's not as serious as the resuscitation. And they are for patients who require more thorough assessment and treatment from a physician for that not immediately life-threatening condition. So that is for major injuries and treatment. Next is minor injuries or minors. So this is, as you can guess, a step below from majors, minors. So the minors is an area for less severe injuries and illnesses that don't require immediate attention but still need some medical care. So that is for the minor injuries. And yeah, that is for the minor injuries. Diagnostic services, and this is a department. The diagnostic services is a department here. It is the department that has access to diagnostic tools like MRI scans, X-rays, scans, different types of scans, like I said before, to help diagnose and treat patients. So that is the diagnostic services. They are determining and they are diagnosing that patient in that particular section. There's the operating theater, which is like an operating room, an operating section dedicated to a patient who needs surgical needs. So that is the A&E department. Some of A&E departments have this, some don't, but some of them have an operating theater available for urgent patients who need surgical needs. So they need to go to surgery right away, all the documentation, worry about that later, but we need to put the patient's life first. That is the operating theater. Coordination with other departments. Now, the coordination with other departments, the A&E department or the accidental and emergency department works and coordinates with other hospital units, including specialized medical and surgical assessment units, acute wards, and critical care units like intensive care or coronary care. So when they are experiencing like a stroke, they will go to the A&E, and after doing all the surgical needs, this operating theater, all of that process, then they will go to the ICU, where they will be monitored 24/7 and check and monitor their condition. So those are the components of the A&E department. And that's also the end of my main video about the A&E department. I hope that you learned something new from this video or just review some of the things that you have learned. Thank you for listening, and I'll see you soon. Goodbye.